Welcome to Dementia-Friendly Prince George's County, Maryland Northern Sector webinar series for caregivers. Today's topic is Medicare benefits and options for coverage, sponsored by Prince George's County Government and the Department of Family Services.
Our presenter for this evening is Mark Gottlieb. Mark is an independent insurance agent who is certified to offer a full range of Medicare products from many well-rated insurers. He'll be presenting on Medicare planning, understanding and optimizing your options. And this is, covering your options during the annual enrollment period, which occurs between October 15th and December 7th. So you all got in at the right time before the end of the annual enrollment period. And it provides opportunities for seniors to make important changes or to enhance their existing coverage. A great deal of confusion exists due to the phone calls and TV ads with which seniors are being besieged. So Mark will help to clarify those confusing ads. And with that being said, I'll turn it over to Mark.
All right, well, thank you very much. And thanks to Sharon and to Crystal Beatty for allowing me the opportunity to provide some education to everyone. Again, it's Medicare can be a complicated topic, and given the annual enrollment period ads and 800 calls and flyers and the like, there seems to be a fair amount of confusion. So I try to do these presentations to clear up some of that confusion and so that people can make their right choices. So we'll go on to the first slide. I'll just briefly introduce myself. I have many years of experience in both the healthcare and insurance fields. I've been an administrator in a senior living community, so I've worked with seniors for a while, and I know this field from both sides of the fence, so to speak. I am an independent agent, so I am working with a lot of different companies and a lot of different types of products, not only Medicare, but of course long-term care, final expense, life insurance, et cetera, et cetera. I am certified by all of the local insurance companies offering these products. So what better way to really know and understand them than to sell all of them and be certified? You have to go through training about all of these different products. So I'm able to offer some expertise about the differences in the different plans out here and which one may be best for a particular person. So with that, I will also say I offer advice to a lot of people in the community at no cost. There are no fees. All my information and advice provided at no charge. I am not reimbursed or not on the rolls, so to speak, of any government agency or any nonprofit or anything else. I'm simply an independent agent, but any fees that I earn are from placing business with these different companies who pay an agent a commission, but I charge no fees, as they say. So feel free at the end of this presentation, not only immediately after, but you're going to have my email address, my phone number. Feel free to ask me questions, ask for information about the different topics. I'm happy to provide them. It's a community service. I'm delighted to do so. So with that, we'll launch into Medicare. And I know I can be somewhat wordy, and it's a pretty lengthy presentation, so I'll be moving through it pretty rapidly. Again, you'll have access to these slides. You'll have access to me through email and phone number to call and ask questions to get additional information without any problem. So I move pretty quickly, again, hopefully not too quickly. And, we'll have a chance at the end, hopefully, to ask some clarifying questions. So really, there are four components of Medicare. There's, of course, A and B. Most people know, A and B coverage when they sign up when they turn 65. Although, of course, if you're over the age of 65 and you're employed and you have employer coverage, you don't have to sign up for Part B, because Part B involves paying a premium. So you really don't want to pay premiums for Part B if you have insurance coverage through an employer. At the time you may be leaving employment is the time when you would sign up for Part B and then worry about these other options associated with C and D. So with that said, Part A is free to anyone who's contributed 40 quarters into Social Security or the Medicare Trust Fund. So that's 10 years, and it could be either yourself or your spouse. Part A, most people understand it because it covers hospital. It could also cover short-term home care post-hospital if you need some skilled nursing care. They're discharging you from the hospital but decide you need a little follow-up. It will cover short-term skilled nursing facility and rehab services with the caveat that you must stay in a hospital for 3 days. I will get to that on a couple of the following slides. But the first 20 days, if you fulfilled the requirements, first 20 days in a skilled nursing or rehab center after you've been discharged from the hospital will be covered. Days 21 through 100, there are copays associated with that. Part A will also pay for hospice. There are a number of hospice care companies that will provide palliative care, pain management, spiritual services to those who are no longer pursuing acute medical care. That's the long and the short of Part A. Part B is everything not inpatient, so it's outpatient, otherwise known as ambulatory care. Often might involve the emergency room, observation in an emergency room in the hospital setting, outpatient diagnostics, lab x-ray, magnetic resonance imaging, MRI, CAT scans, and all of those kind of procedures, as well as therapies. You need some outpatient occupational therapy, speech therapy, physical therapy, all covered under Part B. Part B we do pay for. Some people aren't even aware of it if they're paying through Social Security, but they typically are. So you sign up for A and B, you may be signing up for Social Security or already on Social Security, and you will be billed through Social Security, or you can choose to pay quarterly and just be billed. The new enrollee premium starting 2023 is actually going to be $166. It actually came down about $5. Currently, we're paying $170. So that's a great thing. Premiums for IRMA are charged based on what's called means tested. So if you see those initials, IRMAA, IRMA, it's an income-related means tested approach. So those with higher incomes may be paying more for premiums. That's a way for the government to try to keep Part B in business, given that we're aging, there are more people on Medicare, and it's very costly. Part A, just as an aside, the Congress is going to have to tackle that issue because Part A, is due for a change by 2028. We don't know exactly what's going to happen, if they're going to change the system to ask people to contribute a little. We all hope not. So that's A and B, and a lot of people may only have A and B, but that doesn't necessarily mean you're covered. So when I do talk to people and they say, well, don't talk to me, I'm good, here's my card, thanks anyway, I point out to them that A and B has its shortcomings, one of which is Part B, as hopefully everyone knows, only pays 80% of the fees. So if you have a $100 bill, very simplistically, you go to a doctor's office, there's a $100 charge. Part B will pay that doctor's office $80. That will leave you a $20 copay. Now, there are a number of ways to pay for that, of course, and that's when you get into supplementary types of coverage, which I'm going to be speaking about. So that's A and B. Now we go to the letter C. Everyone sees the letter C these days because we're being bombarded with television ads with a flashing letter C. And frankly, C is Medicare Advantage. So when they're saying that you're getting everything you deserve, you should have a C plan, they are talking about a Medicare Advantage plan. Okay, so you can get a standalone possibly, or with a prescription drug plan. So you must have A and B before you can sign up for a Medicare Advantage plan. That's asked often. If I sign up for an Advantage plan, can I then get out of paying my Part B premium? Unfortunately, the answer is no. We'll talk about that when I get into the Medicare Advantage section. So now we've gone through A through C, and we come to Part D, prescription drug plans. Again, that's something we're talking about during the annual enrollment period, because you can make changes to your prescription drug plan during that period. So that's Part D, plain and simple. I'm going to get into the details of Part D in a few minutes. So with that, we'll go on to the next slide. This was just an overview explanation. Again, in terms of enrollment periods, which can confuse a lot of people with Medicare, there's at first the initial enrollment period when we turn 65. For people who are on Social Security disability income, they can get on Medicare after 24 months of being on Social Security disability. So you may talk to people who are on Medicare and they're age 45, 50, 55 due to disability that they incurred. But for the most of us, we're talking about we turn 65 and get on Medicare, at least A, and if you're not covered through employer insurance, then you go to Part B as well. So the annual enrollment period, AEP, we're in it right now, October 15 to December 7. We're certainly reminded of that every day in many ways. So you can make changes or join a Medicare Advantage plan, can make changes to your prescription drug coverage. So it's a great time to shop around. Something called an open enrollment period. It's actually a do-over period. Most people aren't even aware of it. So if you've signed up through annual enrollment through a new plan, you start the new plan in January, and by mid to late February, you're saying, this wasn't a good idea. I didn't understand the plan well, or I've heard there are better plans out there I should have known. You actually have a chance to make changes until the end of March to change from one Advantage plan to another. You can't do that with just prescription drug, but you can do it with Advantage plans. SEP, special enrollment periods, classic example is you're working and your last day of work is going to be May 31st and you need coverage June 1. Well, you certainly don't have to wait until the next annual enrollment period to sign up. At that point, ahead of the time you're going to be stopping working, you'll sign up for a Part B. Then once you're approved for Part B, you have the right to get a supplement or a Medicare Advantage plan if you so choose. So that's generally what a special enrollment period is. If you lose coverage because of a spouse, you may be having changes of address, which means you're going to have to change Advantage plan or prescription drug, because these plans are based on county jurisdictions. It could be the county, it could be the state. In the case of the District of Columbia, that's a jurisdiction. So you would change from one area to the other. You have to change your Advantage plans or your prescription drug plans. And there's something called general enrollment period. Occasionally someone gets caught into that where they missed a deadline for signing up, like for Part B, and then they can't just sign up the next month, or they can't even sign up during annual enrollment. They need to sign up during January through March, and the coverage then begins in July. So that's a gap you'd rather not face if you can help it, if you stay alert to these issues. All right, so we'll move on to the next slide, please. Thank you. So there are late enrollment periods. I'll just take a second on this. So again, Part A, not necessarily a problem if it's free and there's a late enrollment. A percent of nothing is nothing, so no problem for there. But if you have to pay to be on Part A for people who didn't contribute to the Social Security system or came to this country late. They can buy Part A coverage. But then, there's also issues related to late enrollment period. Same thing for Part B. So you'd rather not miss those periods. Then there's a penalty for Part D, prescription drug sign up. I'll talk about that in more detail when we get to the prescription drug section. But it's basically 1% a month for every month you failed to sign up. You're supposed to sign up within 2 months of getting onto Part B. So some people may get on Part B but not sign up for Part D. They just feel like, thank God I'm healthy. I take very few drugs. The ones I do, I get for a very low discount price at a Costco or a Walmart. I don't need prescription drug plan coverage. But eventually they will. And at that point, there's going to be an accounting of how many months past the time you were supposed to sign up you didn't, and the prices will increase. So that's the long and short of late enrollment. So we'll move on to the next slide, please. So just in summarizing, I want to spend most of my time talking about prescription drug and Medicare Advantage, since that's really what the annual enrollment's about. But I try to give people an understanding of the background of the A and B, which brings them into the C and D. So again, Part A, there's 0 premium, which is great. In addition to being 65 and SSDI, people on end-stage renal disease or with Lou Gehrig's disease also qualify for Medicare. Now, Part A, there is a deductible. So there's no premium, but there's something called a deductible. That means you're kind of paying up front when you need it. So that the rest of the hospitalization will be free, even if it costs tens of thousands of dollars. There is a $1,600 deductible per 60-day benefit period. So really, if you have a Medicare supplement, for instance, that will cover your Part A deductible. If you have a Medicare Advantage plan, you will pay for some hospitalization up front, similar to the Part A deductible. We'll talk about that a little later again. Part B deductible of $226 in 2023. So when you have Part B, you need to pay that first $223 before it kicks in, unless it's covered through a particular Medicare supplement called Plan F. People should be aware of the wide array of preventative tests and screenings that are offered free through Part B. Now, for anyone who's on this broadcast, if you will, this presentation that is on Medicare already, you have something called the Medicare and You Handbook. There's a few pages in there which describe in detail the wide array of preventative tests and screenings. So you should be aware of them and take advantage of them. In terms of the 3-day inpatient rule, I spoke a little about that on the first page and said that the first 20 days will be covered in a rehab or skilled nursing facility if you have 3-day prior hospitalization. Now, that was waived during COVID, but I believe that waiver has just been lifted. So in other words, if you're not in the hospital as an inpatient for 3 days and then you go to rehab or wellness, skilled nursing, you could face a bill. It's a real glitch in the system, and a lot of people have been stung by that. So I just try to warn people who sit through my presentations to be aware of this requirement. And if they're gonna put you into the hospital as an inpatient, but then discharge you before 3 days are over, make sure you talk with the discharge planner, with your physician, with social services. Try to get clarification about that issue if they're planning to then send you over to a rehab or skilled nursing, because most people think, well, go from the hospital, the first 20 days will be paid. But there's that 3-day inpatient rule. That also applies to the fact that a lot of people are going to the hospital, to the emergency room. They're not being immediately admitted, but rather they're being kept in an observation area. They've run some tests, they've done some assessment, they don't feel like you're stable enough or they have enough good handle to say, I'm comfortable discharging this person, they'll be safe. So they may keep you what's called in an observation area. That is not an inpatient unit, even though you're under the roof of the hospital. That's going to be considered Part B, and it will not be considered also as an inpatient day should you stay overnight. So these are just a few things people should be aware of. So we'll move on. Again, there may be a lot of questions. You can ask them at the end. You can email me, subsequent to this presentation. I think that this kind of summarizes some things that I've spoken about already, so I'm just going to continue to move on. All right, so we're getting now into the meat of the presentation. Since we're in the annual enrollment period, you want to know what you should be doing with prescription drugs. Now, a lot of people, just before I get into my scripted notes here, a lot of people will say, well, I have a prescription drug plan, I'm good. I don't need to be bothered with it. I signed up and I've had one for years. Well, two issues. Some people may not have signed up and just have a card that they get at the pharmacy from one of these discount. Good RX is a good example. They're very well distributed, but that is not a Part D prescription drug plan. May give you some discounts, but it may not work for you once some more chronic issues should occur and you're getting into very expensive drugs that are prescribed for you. So be aware of that. And it's important to have a Part D plan. How they work, basically, they're regulated by Medicare. They're discussed in your Medicare Annual Handbook. They're on Medicare.gov, but they're really offered by private insurance companies that have contracts with governments, with the manufacturers, etc. So be aware of that. So there are a number of private insurance companies. Let's say a lot of people know AARP United Healthcare as a prescription drug plan, Aetna, which has a subsidiary, SilverScript, which offers, well-priced prescription drug plans, a company called WellCare, Humana, etc. So when you're buying Part D coverage, you're buying it from an insurance company, which then subcontracts to all of these different pharmacy chains to develop the cost relationship. So, when you go to CVS or to Walgreens or whatever, you're coming in with your card, or at least they have it on file that you belong to the United Healthcare plan or to the SilverScript plan, what have you. So there's a relationship there. And you need to be aware when you're shopping around of which pharmacies are considered preferred by which insurance company, because that will have an impact on your costs. So that's important to know. They're preferred versus standard pharmacies. People should be aware of the issue of generic versus brand drugs, because brand drugs are typically much more expensive. If you can substitute with a generic, in a lot of cases, the costs are going to be less expensive for you. There are a number of phases that I'll talk about real briefly on the next page, but probably one of the most important things to know is there are tiers. The payments that you make, the co-payments you make every month when you go to pick up your prescription drugs, they are pricing them based on these tiers. Now, different companies that I talked about up top may put drugs in different tiers. So if I'm shopping around and I'm saying I take this particular drug and one company has it in a tier 3, which could mean I'm paying anywhere between $40 and $57 a month, and I can find a company that has it in a tier 2 where I'm paying $10 to $12 a month. I certainly am going to think long and hard about subscribing to the private insurance company plan that will give me my drug in tier 2 and save me hundreds of dollars a year just on that one drug. So that's the reason people should, benefit by shopping around during this annual enrollment period to see which plans have which drugs in which tiers. All right. Luckily now there used to be just a few plans that had added a sixth tier for insulin. They called it an insulin savings program. Well, I was happy to see just a few weeks ago they've announced that every company will now offer this insulin program, and insulin costs for Medicare patients will be capped at $35 a month. So that won't be a reason to shop around between plans. Up to now, if you had insulin and you didn't know about the ones that offered the insulin savings program, you could be paying significantly more for that drug. So here's kind of the bottom line of this. Well, of course, we talked a little about why buy Part D. So we talked about the penalty situation. We talked about why you would need a real prescription drug plan versus a good RX discount program. And then most importantly, in my mind, you can't buy prescription drug plans during the year. Medicare has all these regulations and timeframes, such as the annual enrollment period. So you decide you really don't need a drug plan this year, you're fine, and you take very few drugs and you get them very inexpensively. Then an emergency hits or a diagnosis for a significant condition hits. And the physician says, okay, you need to take all of these expensive drugs, whatever. And now you go, okay, I think I'll sign up for a drug plan now. And the answer is you can't. Now you're going to have to wait till the annual enrollment period. So something bad happens April, May, June, you're getting hit with very expensive drug costs, and you cannot join a prescription drug plan until the annual enrollment period, which will then go into effect on January the 1st. So I encourage people to sign up for a drug plan. If you take very few drugs, you take very inexpensive drugs, fine. Probably the least expensive drug plan will be fine for you. And you can sign up for that. And it's really not very expensive at all, frankly. The lowest cost plan, actually, there's one. It was sold this year for $7.10. It's going to be $7.60 during annual enrollment to begin January 1. But here, here's the biggest message of all about this section. You have to consider the premium that you're paying plus the copays. And the copays are determined by what tier your drugs are in, okay? So when you're shopping around, you can do this on what's called the Medicare Plan Finder, which is on Medicare.gov, or you could simply Google up Medicare Plan Finder and it will come up. And you put in your drugs by name, by dosage, by frequency of use. It'll ask you if it's a brand. They'll say, would you consider using a generic? Because when it then gives you the printout of total expected costs, if you use the generic, if you're able to do that, and the physician says it's okay to do that safely, you could save seriously hundreds of dollars. So between the generic issue, between the tiers issue, et cetera, people can save a lot of money. So heed my advice and do it. If you need help doing it, I offer that as a service for free. So I'm happy to, have you take me up on that. So really, you're thinking again about not only the premium, but your total expected out-of-pocket costs, including the copays. Because, our first inclination would be to say, oh, here's two drug plans. This one I can buy for $7.60 a month. This next expensive one is $22 a month. Well, why wouldn't I want to save $15 a month in premium by signing up for the least cost plan? But it's possible that based on the drugs you take, the copays are going to be a lot more in that low price plan. So if you combine the premium plus all the copays, it may be more expensive out of pocket for you over the cost of a year than it would be if you took the $28 plan. So you just really need to be aware of that. Because that's a way that people can really save some money. Then last but not least, you need to pay attention to something called formularies. When you're creating this algorithm and they're telling you which are the least cost, drug plans for you, have to make sure that all of the drugs you put into it are listed as being in the formulary. Formulary, a list of drugs that each drug company prints out. Most of them are very similar, but there are differences. So when you're shopping around, you may find that this plan's a little cheaper, but oh, I see they don't include one very important drug that I need to take. Do you want to take the least cost plan, but making sure that all of your drugs are in that formulary? So that's a lot of information on one page here. So we'll go on to the next page, and very briefly, there are 4 basic phases. The couple of things I'll just talk about, because it gets, again, very technical, is once you get to what's called the regular coverage phase, your pricing is based on those tiers I spoke about in the last slide. And at some point when the costs add up to what's called the coverage gap, many people have heard it as the donut hole. During that period, the consumer will then just pay 25% of the retail cost of the drug. So I might have been paying, here's a real life example, I might have been paying it for a tier 3 drug. I got it at pharmacy every month. It's $47 a month for that particular drug. But somehow there was enough expenses for drugs that I fell into the coverage gap or donut hole. Next time I go to pick up the drug, I'm expecting to pay $47, and I'm told, well, the charge today will be $105. Wow, that's quite a hit. What happened here? And what happened is you fell into the coverage gap, and you're paying a straight 25%. The retail cost of that particular drug is $420. So instead of getting the tier pricing of $47, I'm now getting 25% of that $420 drug, which is $105. So that's kind of like a bit of a shocker, but that's the reality of how these things work. And then you finally get into a catastrophic phase. Hopefully no one gets there, but if you do, the big issue is if you're taking a brand drug, you could pay $10.85 or 5%, whichever is greater. So if you end up with very, very expensive drugs due to a rare chronic condition, that's when you can get hit with serious problems. Now, there was just some legislation passed. We're hoping in a year, when they put those regs into effect, they're supposedly saying that seniors will not have to pay more than $2,000 out of pocket for the whole year. That will basically cover the catastrophic phase, because it can be catastrophic indeed. That's why it's named that. Right now, people will go to a state pharmacy, drug assistance program with the manufacturers who have foundations that will provide assistance to people based on a sliding scale. So if you don't have a lot of income, but yet these drug companies are asking for thousands of dollars for this rare drug, if you don't get help, you're in deep trouble. So luckily, a lot of people will find ways of getting that picked up through either the state or through the manufacturer's foundations. So that's plenty of detail as far as Part D goes. So we'll continue on. Now, there is something called the Low Income Subsidy or Extra Help Program, which is fabulous. So if you fall, they have, state and federal guidelines, but typically if you fall anywhere in the up to 150 of the federal poverty level, you will qualify to get help through the Extra Help Program. So you make more than that, you can qualify for Medicaid, but yet not enough so that you can meet all the expenses of life, especially when it comes to these drug costs. So in this case, the government has this extra help program through Medicare, and they will help you pay with your Part D premiums, your deductibles, copays. So it's a fabulous program. If you don't know about it and you need some information, contact me subsequent to this meeting, and I will send you some information that will be helpful to you. I probably didn't also make the point that there's a similar program for Part B, which can help you pay for your Part B premiums. It's called the Medicare Savings Program. The qualifications income-wise are similar. All right, so those are some good things to know about as we go about trying to make sure we have the best coverage we can. So Sharon, next slide, please. I actually did put the Medicare Savings Program in again. So this is for the Part B section. The low income subsidy or extra help was for Part D. So since you have access to this package, we'll leave it at that. So we'll move on to the next slide. And so kind of summarizing, especially when it comes to A and B coverage, you know, there are all kinds of, then you throw in the fact that you should have a Part D plan. Well, what are my options and what am I going to do? You know, you can sign up for A and B, just add the Part D, and then not get some kind of Medicare supplement, Medigap, Medicare Advantage. You can get the A and B and get a supplement and a Part D. You can join an Advantage plan. There's yet some other kind of plan, which is a little too complex to discuss. I may discuss it like in 30 seconds or less at the end of the presentation, called the Medicare Savings Account. But my big takeaway from this slide is if you have a retiree health plan, I run into a lot of people around here who've worked for the county, the state, the feds. They have retiree health programs. Probably very good. They're probably very lucky to have them, but they, or if I'm talking to you who's attending tonight, have one, make sure you understand what you have. Just don't say, well, I have this card, it's a retiree program, and put it away in the drawer. Get some kind of an outline of coverage, an evidence of coverage, a summary of benefits. Make sure you have the kind of coverage you need, because there are different levels of these plans. Some are low option, some standard, some high option. Some have premiums higher than others. So, you know, in some cases, people may have a plan, but it's not one of the higher level plans. They're going to be better off with a Medicare program. So one needs to understand it. In some cases, you may not even have to have a Part B, which can be tremendously advantageous in terms of saving those premiums. Other people should have a Part B and don't know it. So make sure you know what you have before you need it, because once you need it and the surprises start coming, that's when the problems start coming. That's my advice as far as that goes. And so we'll now move on to the Medigap and the Medicare Advantage plans. So there are a number of gaps in our A and B coverage, which, you know, could be costly if we don't have some kind of supplemental or Advantage plan. Of course, there are other things not covered by Medicare at all. Two classic examples, and this is why we're hearing so much from the Advantage providers, is dental and dentures, vision and hearing. Those are the two main you know, areas where Advantage plans are, you know, kind of making the point that, hey, you should get everything you deserve. You know, if you don't have dental or you need better dental, we may be able to provide that to you. You're not going to get that through A and B. Same thing with vision, same thing with hearing. So how do we bridge that gap? Of course, a very big gap is Medicare will only pay up to 100 days. After 100 days, on day 101, we're talking about a subject called long-term care. I'm sure you've all heard about that. You know, there's often a lot of research on that. I do a lot of programs on that. That's a subject for another day. But in any case, let's take a look at how we can bridge some of these gaps. The first slide will probably talk about Advantage. If we go to the next slide, please. Okay, I actually put the supplement plans in first. So one summary page about supplements. A lot of people will sign up for Part B and then buy a supplement to cover the other 20%. As you remember, I started out the presentation saying that Part B only covers 80%. Again, some of the ads you see, not during annual enrollment so much, but during the year, you'll see a lot of ads, often by AARP United Healthcare, reminding people that Part B only pays 80%. So they'll turn around, get a Medicare supplement plan to pay the extra 20. Medicare supplement is a nice program that allows you to go to any Medicare certified practitioner throughout the United States. They emphasize the fact that there's freedom of choice, no networks, no referrals. You can go anywhere and be anywhere. If you travel a lot, certainly advantageous to have a supplement plan. No restrictions as far as that goes. Typically, people will buy a Medicare supplement right after they sign up for Part B. And if they do so within the first 6 months after they have B, they get the privilege of what's called guarantee issue, no underwriting. So whatever your health problems are, doesn't matter, even though you're dealing with insurance companies who are typically undertaking something called underwriting. They're going to look at your specific issues and decide whether or not they want to accept you. So the first 6 months of guaranteed issue is a real blessing. You know, if you wait till after then, let's say a few years later, you say, okay, finally, I'm ready to buy a supplement, you will face underwriting. So if your health is pretty good, fine, they will sell you a Medicare supplement plan. If not, they will tell you you do not qualify. And then, as you'll see in the coming slides, that will relegate you to using an Advantage plan. Now, you know, for people who've moved from somewhere else, if they had a Medicare Advantage plan, they're moving to this area and they would like a Medicare supplement plan, even though they have health problems, they can get supplement coverage because they lost their Medicare Advantage coverage, what we'll say in an involuntary way. In other words, when you leave one geographic area to come to another, even though you didn't want to lose that plan, you're an involuntary termination. You're going to have to replace that plan with another plan. Typically, people will come, let's say you're coming from Philadelphia, from Kansas City, from New York, wherever it is. I was enrolled in this Medicare Advantage plan. You can't take it with you. It's not portable like Medicare supplement. You know, so in those cases, when they had a Medicare Advantage plan and left, let's say they now move here, they could get a Medicare supplement plan because of that change in geography. So that could be very beneficial to people who move and who have a lot of health problems, because that way they can avoid all of the out-of-pocket costs associated with Advantage plans. All right, so there are plans A through N. Most people who signed up in years past for Medicare supplement are most familiar with the F plan. It covers everything, as F is in Frank. The new F now is the G plan. So if you're about to get onto Medicare and you didn't have at least Part A before January 1, 2020, then you will be offered a G plan. And it covers the same things as the F plan did, other than that small deductible that I was talking about earlier in the presentation, which is going to be $226. There are some high deductible plans where you can pay much lower premium, with the caveat that you have to pay the first roughly $2,500 out of pocket. It's a lot of money, but yet, you know, may still be worth it if you think you're going to have a lot of medical expenses. you're able to get a high deductible plan. The cost of the relatively low premium plus the, deductible will still be less than if you're paying a lot of out-of-pocket costs with an Advantage plan. So that kind of gives you an overview of Medicare supplement plans. Of course, if you buy a Medicare supplement plan, you'll also want to supplement it with a Part D prescription drug, because the supplement only covers the medical. Whereas, nice segue here, if you join a Medicare Advantage plan, in most cases, they will combine the medical and Medicare Advantage with the prescription drug, basically called MAPD plans. They're offered by just insurance companies, Aetna, Cigna, AARP, United Healthcare, and Care First primarily. Examples of large medical care delivery systems that offer Advantage plans are Hopkins and Kaiser. Now, unfortunately, in Prince George's County, Hopkins does not offer the Medicare Advantage plan. So you can't buy one if you reside in Prince George's County. Kind of a quirk. As I mentioned, these things are offered county by county, jurisdiction by jurisdiction. For some reason, Hopkins has not set up a plan to be offered in Prince George's. So if you're looking at a medical care delivery system plan, it's through Kaiser. They have 3 different options there. In effect, you sign up for an Advantage plan, you're signing over your Part A and B coverage to the plan. And that's why people will say, well, do I have to sign up for Part B if I'm signing up for one of these Advantage plans? Absolutely. And the reason why is you're turning your coverage over to that plan who's going to provide the medical care and then bill Medicare for your A and B reimbursement. Okay, so that's the way they can make money, or at least stay in business. That plus they're going to charge you different copays. So that's how Advantage plans work. Your premium is going to be low, but then you're going to have a series of copays. Most people are looking at regular Medicare Advantage plans. There are a few occasionally that are called chronic needs, special needs plans if you're a diabetic or have congestive heart failure. Some great plans really for, again, lower income. If you're on Medicaid, I hope everyone understands, you can be on both Medicare and Medicaid. Medicare is an age-related program other than for these special needs like an ESRD or a Lou Gehrig's disease, a Social Security disability. Everyone else, it's related to turning 65. That's Medicare. On the Medicaid side, you could be any age, and it's an income-related program. So seniors can certainly be both on Medicare and Medicaid. And I'll explain that there are several types of, the lower income. It goes back to my discussion about the low income subsidy in the Medicare Savings Program. But if you're on the several levels of those income ladders called full benefit dual eligibles, FBDE, or QMB, qualified Medicare beneficiary rather. If you're in one of those 2 categories, you can be considered to be signed up for a dual eligible special needs Medicare Advantage plan. And it has a lot of very popular features, which I'll show you. So really, the main things you need to know about Medicare Advantage plans, they're contracted in-network providers. They make money by being a managed care organization. So they're getting all these streams of income, and they are contracting with a group of providers who are called in-network providers. So if you're going to join a Medicare Advantage plan, or most Medicare Advantage plans, I'll give you the curveball on this in a moment, but most are in-network providers. So you want to make sure your physician or physicians or practitioners, providers, even if it's a physical therapy chain or You know, if you do have end-stage renal disease, which are the end-stage renal disease facilities which contract, and they even contract with hospitals. So depending on which plan you join, you want to make sure that the hospital you would prefer to be able to go to is in the network of that particular Medicare Advantage plan. So this is where all the shopping comes in and where people need to understand these finite details. It goes way beyond what they're telling you in these 1-minute commercials. So, you know, you have a contracted group of providers, then they will give you some add-on services. An example of that, of course, is some dental, some vision, some hearing. And then there are a series of out-of-pocket copays. Now, there's 2 types of Advantage plans. Most of them that are strictly in network are called HMOs. You can have PPOs. There's I think 1 really in Prince George's County, and it's a very good plan. You know, so if you join a PPO and you don't go to the in-network providers within the PPO plan, you can go out of network, but you will pay more. So you need to be aware of that. But it does give you some additional choice and additional leeway to pick other sets of provider organizations. All right, so we'll go on to the next page. And here's some examples. So this, you know, surprises people who don't understand how Advantage plans work. So, you know, you have your A and B, you join the Advantage plan. Now you have a series of out-of-pocket copays until you hit a maximum. So for instance, hospitalizations, all of the Medicare Advantage plans will have a series of payments. If you're hospitalized, you have these copays. Now, some people will say, well, wait, I'm on Part A. I should not have these copays, you know, other than that Part A deductible. Well, yeah, but you are now part of an Advantage plan, and they do charge copays. So you have to be aware of that. Of course, that'll substitute for the deductible you would have had to pay if you weren't in an Advantage plan or a supplement plan. So you might get hit with 4 to 6 days of copays of anywhere from $3 to $350 a day for that. Emergency room could be 50 to 100. Now these variations are based on which plan. You know, we're talking about a number of plans. One may ask 300 copay, the other 350. Same thing. You know, some plan may charge 50 emergency room copay, another 100. Again, this is all the components of shopping around when you're looking at which Advantage plan you might want to join. Going for ambulatory surgery, you're going to have a copay for the ambulatory surgical center. Going for an MRI diagnostic exam, again, a range of costs. So you shouldn't be shocked. You know, you're paying a low premium, but then you're cost sharing until you reach what's called the out-of-pocket maximum. Once you've put out a certain amount of money, they'll say, okay, you've hit your out-of-pocket requirement. From here on in, you're covered 100%. And that's one of the important things about being a member in an Advantage plan versus deciding I don't want to be bothered. Because if you have A and B, you don't have a Medicare supplement, which is presumably much more expensive, then you're going to continue to have those out-of-pocket costs. You know, it's still going to be the 80-20 cost share, and it could, if something significant happens to you, you know, you could have cost shares a lot higher than the out-of-pocket maximums for an Advantage plan. So these are some examples of what you should be aware of when you look at outlines of coverage from these plans. All right, so we'll move on. We're probably getting close to the end of our time frame. Yeah, I always end up running late when I try to provide too much information to people. So some of the good things, prices are consistent regardless of age. So whether I'm 65 or 95, if I sign up for an Advantage plan, the premium's the same. That's very much different than a Medicare supplement plan where your prices continue to go up. The older we get, the more we're going to pay, whether we're first joining the plan or if we've been in the plan, we're going to have annual increases. Unfortunately, this really, presents a great challenge to a lot of people. Again, there are dual eligible plans. The premium is zero. If you're on Medicare and Medicaid, they now have a new dual eligible plan right now that just was introduced, where you could fall into some of those other income levels above Medicaid, and you will get some of the benefits of the dual eligible plan. It's a nice thing. Plans differ by jurisdiction. No underwriting. That's a very valuable component. Well, I'd really rather have a Medicare supplement plan, but I'm still under treatment for cancer or just finished within the last 6 months. Will a Medicare supplement plan take me? No. Okay, well then at least you have the advantage of being able to sign up for an Advantage plan. I talked about the in-network versus the out-of-network with the PPO. One other quick thing, added value. They all talk about dental, and it makes it sound like once you join, you can have as many procedures as you want. You've been waiting for those caps, for those implants, etc. Not so. The basic dental, for the most part, will only give you preventative dental. They will add on for a fee additional dental coverage. Now, you can also buy dental coverage through what we call standalone dental plans, whether you join a Medicare Advantage plan or not. So that's something you should be aware of. If you're eligible for a dual eligible plan, you get a lot of extra benefits as well, typically up to $2,000 in extra dental, transportation, meals after hospitalization, vouchers for over-the-counter supplies and equipment at pharmacy chains. So, that could be extremely valuable. I'll leave it at that. A lot of people will ask me about dentures and hearing aids. Most of the plans will offer some coverage for those, but it'll be kind of a cost share. So let's say you need a denture, it's going to be $2,000. Shop around for the plans. Typically, they'll say, okay, we'll pay $1,000 towards your dentures. You have to use these specific providers or companies that do the manufacturing. Then you'll pay the rest. But again, hey, if I need dentures and I know I'm not in this plan, and I go to shop for dentures and it's going to cost me $2,000, I join this plan, they may cover $1,000 of that $2,000. That's an extra $1,000 that I just found, and that's a valuable additional benefit, assuming every other feature of the plan, works for me. All right, so that's kind of an overview of how Medicare Advantage plans work. Typically, people like to keep their own physician, so one of the first things a person will do possibly is call their physician and say, do you participate in any of these plans? And he or she may say, yes, this one, or yes, all three of these. And then, you can make your decision based on other factors. But if they only participate in one of the plans and you want to keep that physician, well, the decision is almost made for you on that basis. So I think that pretty well finishes up, other than I have a quick list of the plans that are offered in Prince George's County for the coming year. I talked about some of these, so, just some extras. One other thing I'll mention, since I have this slide here, there are MA only, Medicare Advantage only plans for veterans who may get their drugs through the VA. So they don't need the prescription drug component. So they get Medicare Advantage plan for $0 premium, and they get some extra dental benefits and some other add-on benefits. So if you're a veteran, it could be worth looking into. The other thing I'll say is, often on the television ads, we see them talking about the buyback program, 4 arrows from the bottom, not offered except for the veteran plans. Would be great if they were. They talk about adding money back to your Social Security. What that actually means is, when they're taking the money out from Social Security to pay your Part B premium, they'll take less because the Medicare Advantage plan is subsidizing it. But again, unfortunately, other than for the veterans programs, that's not yet available in this region. It is in some parts of the country, but not here. So when you see that ad, they use that as kind of a come on. They're saying, well, everyone's going to want to see if they can get some money back or pay less from Social Security. Then once I have this person on the phone, I can say, well, based on your zip code, it's not available. But while I have you, what can I sell you today? So just be aware, unfortunately, the buyback program is not yet being offered. And I think the one more slide about the plans in Prince George's, and we'll quickly wrap up. You can go, I have these for all the counties I present. So in Prince George's, there's a company called Alterwood, spin-offs from several other past companies, including MedStar, which some people may remember that left the market several years back. So they have several plans. Care First, which a lot of people are familiar with this area, has 2 levels of plans, a core and an enhanced. Cigna has an HMO plan. Kaiser has 3 different plans, very good plans, assuming you like the Kaiser model of going to their facility, kind of the one-stop shop methodology of providing care. AARP United Healthcare has their 2 PPO choices. And the dual eligible plans, I need to modify this slide to include the Care First dual eligible plan as well. So there's, definitely some shopping to be done. I do have information about all of these. If I can help you in any way, feel free to reach out to me at no obligation. And that's pretty much the presentation for tonight. So Sharon, do we want to talk about, we'll skip the rest. Do we want to try to further information? This may be a slide people would like to have. It has my information, also shows you sources of information about Medicare.